Hey folks, it's Dr. Gerstmar from Aspire Natural Health, and in this quick video, I want to talk to you about your thyroid. Now at Aspire Natural Health, we see a lot of people with thyroid issues. The fact is, thyroid issues are disturbingly common in our society, and some of the most common reasons are things like autoimmunity, toxicity, nutrient deficiencies, and other hormonal problems. We often get questions like, does everyone need to take thyroid hormones? Or can I stop taking my hormones? Or why is my thyroid having an issue in the first place? To better understand questions like these, it helps to divide thyroid problems into two big buckets. Now, these buckets are one, functional thyroid problems, and two, pathological thyroid problems. Let's unpack what that means. Pathology is the study of disease. So a pathological thyroid problem is going to be a thyroid issue where there is significant disease present. That can range from autoimmune damage to the thyroid and Hashimoto's, to the hyperthyroidism of Graves' disease, to thyroid cancers or tumors, or diseases in other organs of the body that are causing thyroid problems. Generally, the conventional medical community is pretty good about finding these issues, and so most people with pathological thyroid issues are aware of it. The other bucket are functional thyroid problems. In a functional problem, there is no disease present, and if you look at the thyroid, you're not going to see it looking messed up. But it's not working or functioning in the way that it's supposed to. And that's why you're having the symptoms that you are. If you have a lot of symptoms of a messed up thyroid and you've had the proper test done and they've told you that your thyroid is fine, chances are you might have a functional thyroid problem. When we look at questions like what's going on for a person and whether they're going to need thyroid medication, we're looking at whether they have a functional or a pathological thyroid issue. Now, let me give you a couple of quick examples. Linda, which is not her real name, came to see us with long-standing Hashimoto's. For anyone who's listening who doesn't know what Hashimoto's disease is, Hashimoto's is an autoimmune disease where your body's immune system is attacking your thyroid. And over time, the autoimmunity chips away at your thyroid, destroying it. Now, my personal experience has been that if someone has active Hashimoto's that's been going on for more than 5 years, their chances of getting completely off thyroid medication, unfortunately, are quite low. Linda had been dealing with Hashimoto's for more than a decade, and she was not able to stop her thyroid medication without feeling terrible. Her thyroid had just been too damaged over the years by her immune system. Our bodies have a tremendous ability to heal and rebuild themselves, but there are limits. And a frustrating reality check is that we're not always going to be able to heal everything as much as we want to. All right. What we did find with Linda, however, was that by finding the right type of thyroid medication, we were able to help her feel better. By working on her digestion, we found that she actually needed less thyroid medication. And by working on the rest of her, after all, Linda wasn't just a thyroid, she was a person. We were able to take care of the other issues that were going on for her, and Linda was a happy camper. That is a pathological thyroid problem. In contrast, Mary, also not her real name, came to us with many of the symptoms of low thyroid. We did a comprehensive evaluation which showed that her thyroid was not working well, but there were no signs of pathologic issues going on for her. As we began to work with her, we decided that because her fatigue and her symptoms were dramatically interfering with her life, that we would do 3 months of thyroid medication while we worked on the underlying causes. The medication helped her feel significantly better, and she did the root cause work. At the end of 3 months, we were able to wean her off the medication, and she continued to feel great. Mary's thyroid did have a problem, wasn't working right, but it was not because it was broken, but because of other issues she had going on, like an inappropriate diet for her, high stress levels, and other hormonal dysfunctions. So there you have it. Not everyone with thyroid problems needs to be on thyroid medication or needs to be on it for the long term. And some people absolutely do need to be on thyroid medication. One of the keys to understanding whether you need to be on thyroid medication or not is understanding whether you have a pathological or functional thyroid issue. And a good practitioner should help you to be able to do that. Now, if you'd like to know more about your thyroid, I'd like to offer you an audio recording of a lecture I gave on what the real holistic treatment of your thyroid looks like. All you need to do is click the button below and fill out the short form, and we will happily send that to you for free. So please click down below. At Aspire Natural Health, we are experts at treating digestive issues and autoimmune diseases. If that's you, we'd love to connect. We offer a no obligation, no pressure chat to see if we can help you, if we're the right fit to work together. If we are, we'll move forward. And if we're not, we will do our best to connect you with the person who can best help you. You have nothing to lose, so please call us now at 425-202-7849 or email us at info@aspirenaturalhealth.com. Until next time, folks, take care.